course, we are in the middle of a rough and deadly flu season. Here in the Houston area, flu-related death toll going up. 2 new ones now. Harris County is reporting 3 this season. That's up from 2 in January. And now Galveston County says a 48-year-old woman with a pre-existing health condition also died as a result of the flu, bringing the number of deaths there to 2. Montgomery County previously had reported 3 deaths this season, and the city of Houston had reported 2 deaths.
Okay, so a big question here. How do you know when your flu is turning serious? And
joining us now is emergency medicine physician Dr. Henry Wang. Thanks for being here.
Thank you for having me.
No problem. First question. So what's the most important sign that things are getting much worse when you have the flu?
So as your viewers may know, the flu involves a constellation of symptoms which may involve fever, fatigue, severe coughing, and probably some of the worst muscle aches you can ever imagine. These symptoms are common to all cases of the flu, and usually the treatment is lots of rest, hydration, Tylenol, and Motrin for the treatment of the symptoms. When are things getting worse? This is a very important question for all victims of the flu to know. In very general terms, if someone's heart rate is elevated, if their blood pressure is low, if they're having trouble breathing, or if they're confused or unconscious, those are signs and symptoms of the worsening of the flu. And certainly in those conditions, one should go back to the hospital, or in more severe cases, pick up the phone and dial 911 for help.
Yeah, because people forget that even if they've been to the ER, they can go back if they need to, if things get worse.
Absolutely.
I wanted to ask about a lot of these deaths that are happening that have pre-existing conditions. Are there certain pre-existing conditions that are more susceptible for when you do get the flu, you just have worse symptoms?
We know that the elderly are particularly susceptible to the flu, and it's complicated by their other chronic illnesses. We know those who have weakened immune systems, such as those who may be using special immunosuppressant drugs, may be particularly vulnerable, and of course children are particularly vulnerable to the flu.
All right, so we've asked our questions. Now let's look at some of the viewer questions that we've been asking and getting on Facebook. Veronica asks, Doctor, is Tamiflu safe and effective?
Tamiflu is a useful weapon in our war against the flu, but you must take it within the first 2 days of your symptoms. If you've been having symptoms for longer than that, the drug is less effective.
Okay, this is an important one because I feel like people in our newsroom have argued about this. How long are you contagious after getting the flu?
Probably for at least 1 week.
1 week?
1 week, yes, it's a long time.
Yes.
And so one can safely conclude that once your symptoms have resolved, your coughing, fevers, and chills have resolved, you're probably safe to go back to work. We know that it takes about a week for you to feel much better from the flu.
Okay, and here's one other one. Another person asks, can you have the flu without the fever symptoms?
It is very possible. What is very difficult to differentiate is flu from the common cold. Many of the features are very similar between the two, but the flu symptoms are much more severe. Higher fever, worse muscle aches, worse fatigue. Those help to differentiate the two. But yes, you can have the flu without some of the classic features.
Right. Dr. Henry Wang, thank you so much for answering our questions and our viewers' questions. We really appreciate it.
Thank you.
All right.